And welcome back. We are live again with our Ebru think tank here on Fresh Outlook. Let me introduce our guests today. We have Patricia Taylor, who is a registered nurse. We have Albert Goldson, who is a global advisory expert. We are also joined by Jose Lopez from Seton Hall University. And in Washington, D.C., we have Allan Topol, who is an well-known author who will be sharing his thoughts about the Ebola outbreak. I'm going to start with a headline, and Patricia, this hits home for you since you are an RN and there's nobody more hands-on than somebody like yourself in certain situations. What's the headline? What do people need to know about Ebola?
The headline is that there is a risk to healthcare professionals, those who come in contact with the bloodborne pathogens, and they need to follow barrier precautions, standard barrier precautions.
And standard barrier precautions that you would do with somebody with hepatitis or HIV would be enough? Any
viral precaution is enough. That's wearing masks, gloves, protective clothing, understanding how to put this equipment on, understanding how to remove this equipment and not contaminate yourself in doing so, and understanding how to dispose of the equipment appropriately.
I'm going to give you one more question. I told you everybody's going to get a headline, and we will do that. But if I'm sitting here and you're sitting there, am I at risk if you have Ebola?
No, you're not.
Okay.
It's not airborne.
We're going to get more back to that in just a little bit. Albert Goldson, what is your take on Ebola? What's your headline from what we've learned this week?
Well, definitely the security measures that are being put in place. Of course, they're not perfect, but something absolutely is being done at, as far as border controls are concerned. They are using equipment to indicate whether a passenger has a high fever or not, but you have to keep in mind that the incubation period for Ebola is between 22 and 21 days. The average, according to the World Health Organization, is 10 days. So again, it's an imperfect system. However, it's something that's being put in place that can help us identify those passengers who are.
And to react to your headline on all this, when I hear that the United States is now implementing these measures, I'm like, I can't believe they didn't do it already. We were told weeks ago that we were going to make sure that this virus was contained, and only now they're beginning to screen at JFK Airport. We'll talk more about that in just a little bit. Jose Lopez, what's your headline?
I think it's the issue is in West Africa continues to be the infrastructural problem they have there. They don't have the first world infrastructure that we have. We get somebody who comes contaminated on a plane from JFK, and we are able to contain that and do that. But in West Africa, that's not the issue. That's why this is becoming an epidemic right there, and it's starting to spread out.
Okay, and we're going to talk about that and the war on poverty and how it might be related to the spread of disease later in this program. Let's talk a little bit now to Allan Topol. Allan, what is your Ebola headline for the week?
Perhaps because I'm in Washington, so I'll give you the Washington perspective. My headline is, as this tragedy unfolds, it truly is unfortunate that the United States government didn't move quicker and even now did not exert any kind of leadership. Leadership, I'm saying, in two areas. First, we can't close our borders. We have got to be more instrumental in getting supplies into West Africa. That's critical. And the second thing is the U.S. government has got to get behind the program to develop a vaccine. We alone can do it. There are two tiny little pharma companies who are working. These companies can't develop anything and won't be able to produce it. The United States government has to move in and almost like a Manhattan Project and get the thing done and get control of the process, or this will be raging in the United States before long.
Good points, Allan.
It's unfortunate that in Washington they're not moving.
I'm going to hold you right there. Excellent points all around.
Fault.
Let me bring you over to Patricia once again. How do we stop the spread of this disease here in the United States and beyond our borders?
You stop the spread of the disease in the United States by quarantining the individual, isolating the individual in a hospital, in a private room. You use personal protective equipment, as I mentioned earlier, headgear, face mask, gloves. You understand how to use it. You continue with maintaining the health of that individual with fluid, hydrating the individual, treating the other symptoms that individual may have. And in the U.S., we are using experimental drugs to help combat the disease.
And Albert, that's fine and good here in the United States. We can get our private rooms, we can get our own individualized respirators, we can get our own clean needles, but in West Africa, people are much more congested, impoverished situations.
Well, absolutely. Again, it's a developing region for starters, and they've gone through quite a number of civil wars. So the medical care, unfortunately, because of those situations, is abominable, and it's basically literally a petri dish for something like Ebola to run like wildfire throughout the population.
Jose, should we stop all flights in and out of Western Africa until they get a better handle on the situation there?
Absolutely not. I mean, we're not going to be helping them out with the problem they're having. I mean, if we isolate ourselves and isolate them, that's not going to help the problem. As Albert pointed out perfectly, West Africa is a petri dish. I mean, part of this epidemic started from cultural things, like they were eating bush meat, which is eating monkeys and bats and different things. And these are organisms that are not usually eaten in other parts of the world, and they bring viruses into the human species that were never seen before. So this is why it becomes, as you said, a petri dish of new diseases that start to come about.
It's a frightening situation that you describe over there, and again, we're going to talk a little bit more about how we help them financially. Perhaps will help us in the long run if we have to be so selfish, and sometimes from a national perspective you have to be. You put your own people first. Let's turn now to Ed Marshall, who is joining us via Skype. He is the CEO of Medizone, and this is right up your alley, Ed, because your people are working on treatments and preventives for this illness, Ebola. Tell me a little bit about your work and what your company does.
Our company is actively engaged with a hospital disinfection system called AsepticSure, which is now proven to kill 100% of all bacterial pathogens in hospital rooms, as well as viral pathogens. We just recently completed some work with the National Research Council Canada viral laboratories in Montreal, and in that work, we worked with MERS Corona, the study surrogate for MERS Corona. There's no study surrogate for Ebola, but we 100% eliminate the pathogen in hospital spaces. And we recently did a demonstration for the Canadian military, the Canadian Red Cross, and Doctors Without Borders. The demonstration was done at the request of Doctors Without Borders. They had heard about our system, and they asked us if it would be possible to design a field hospital prototype, a tent system, that would use AsepticSure in order to demonstrate in Africa that these remote hospitals could be sterilized.
And I'm going to just stop you there for just a second. I'm glad that your company is helping with the sterilization and the spread of disease within hospitals. Let me ask you what is on the front of a lot of people's minds right now. Is there a cure for this, or is prevention the only way possible, the only way forward? Is there a potential cure down the road?
Yeah, I feel very strongly about this from 20 years of experience working with medical ozone, which is just, you start with O2, medical oxygen, you run an electrical charge through it, you create a new element called O3. And in Germany, in Cuba, in Russia, in Italy, but mostly in Germany since the mid-'80s, they've literally treated millions of people with diseases that are viral in nature from this same family of virus, which is referred to as lipid enveloped. And those diseases include hepatitis B, hepatitis C, HIV, and Ebola falls into that category.
Okay, Ed, I'm going to hold you there for just a second. Very interesting points. I'm going to turn over to Patricia. Years ago, when AIDS first came on the scene, I was told by medical researchers that a virus has to run its course and it can't be cured. We have made great strides since the 1980s, and there has been a lot of advances in fighting viruses such as these. Do you agree with what Ed is saying, that some of the virology studies that we've done and some of the work we've done will actually bring about a cure for Ebola?
Definitely. I think the work that we've done and the work that they'll continue to do will bring about a cure for Ebola. I worked in the hospital during AIDS epidemic, and we were scared to death about the virus. And at that time, all we could do was prevention, protect ourselves, protect other patients. And I really think that we've come a long way in medicine and technology, and we will develop a cure for this.
Let me turn to Albert for just a second. We had a death in the United States this week. 42-year-old Thomas Duncan in Dallas, Texas area, died at the hospital. He went to the hospital. He was spiking a 103 fever. He had told them he had traveled to West Africa. Are you shocked that the medical professionals there did not flag him as a potential for having Ebola?
Well, that is shocking, but at the same time, because Ebola is considered pretty much an Africa-specific situation, you probably would not expect a patient to be in that part of the country, perhaps in New York, perhaps in Los Angeles, but that is the last place that you would expect that type of patient with that sort of condition to arrive at a hospital.
Jose, let me ask you a little bit about, we were talking about poverty before, we were talking about the conditions that people live under in West Africa in many cases. Are we able in this fight against Ebola to get them up to speed financially, economically, medical care?
I mean, absolutely. I mean, we're the richest nation in the world. I mean, the European Union is there, much closer than we are even to the ground there. I mean, it's an infrastructure problem. They don't have access to clean water, clean food. I mean, before we have a plate, a steak, or whatever we want to eat on our plate, it's been FDA approved and checked and certified that there's no pathogens, that there's no viruses, nothing in that meat. This is not happening in West Africa, in Liberia, that entire region of the world. So that's part of the problem. Their food, their water sources, the things that are keeping them alive, I would say the first needs that all humans have are not adequately met there. The population is growing very quickly, very fast, larger than the infrastructure can handle at this point.
All right, let's turn to Allan Topol for just a second. Allan, what is your take on the death here in the United States of Thomas Duncan, and also the legal ramifications of this, that this guy went into the hospital, should have been diagnosed, I would think, and was not, sent home?
Right. That's obviously, as your other speaker said, very troublesome that he wasn't diagnosed. But I mean, from a legal and other perspective standpoint, as one of your speakers said, the infrastructure has to get to Africa. The vaccines have to be developed. I think our United States government has got to be more active and more aggressive on the whole situation. We have to recognize it as a threat to the United States. We're not going to be able to close our borders. We have to get more involved, and we have to commit more resources. And I would love to see it being done, both in terms of getting supplies in Africa and in terms of developing vaccines. But unfortunately, Washington, where I am, is moving very, very slowly. And the illness, which is multiplying every week, is moving much faster than our response. And
okay, Allan, I'm going to hold you right there just because we're running out of time. Again, all excellent points. Let's turn to Ed Marshall, CEO of Medizone, for a final word, what he wants the takeaway of this discussion to be.
Okay, I'd like to make a couple of points. The Saudi Arabians who we're in close communication with recently had their Hajj, where Muslims once in their lifetime come to Saudi Arabia. They blocked all flights from 3 or 4 countries in West Africa. It was a temporary thing, but they avoided any Ebola cases. They had already had a couple in the country. You can't keep your borders as open as they are today. Yes, you have to keep your borders open. Yes, you have to have people and supplies going back and forth. But I really believe it's important to restrict some of these flights and some of this travel, especially the unnecessary travel. That's one thing. Or you're going to have more Ebola in this country. The second thing is, and this just drives me crazy personally, there is a treatment for this disease called ozone therapy as practiced by the Germans. We could probably cut the death rate in half if we simply treated people with ozone therapy as practiced by the Germans. And it's very inexpensive, and it's very easy to do, and it just has never been accepted by the FDA, and it's not practiced in the United States. And quite frankly, my own opinion is the only reason it has been ignored for 30 years is that it's a major hit financially to the pharmaceuticals.
Ed Marshall, CEO of Medizone, we appreciate your time and your insight on this topic, as we do with all of our guests. When we come back here on Fresh Outlook, a young black man is shot to death by a white cop in Missouri. Yeah, it's happened again. More on the latest case that is stirring up racial tensions here in the United States after this.